preconception care, antenatal care, and postnatal care all are equally important. But nowadays, in our practice, I think the postnatal care is very more relevant than comparing to this antenatal practice and also preconception practice. But for getting a healthy progeny and for nowadays, we know that there are so many children having different situations having the some congenital abnormalities or otherwise autism spectrum disorders. Some different type of problems are developing in nowadays in small children and in infants. But as a whole, we in the infertility practice, we know that there are so many things by donor egg, donor ovum, or otherwise ICSI practices, and then freezed embryos. There are so many practices are happening nowadays. So I think to promote, it's our duty, our physician duty or Ayurvedic physician's duty to promote the role of preconception also to getting a healthy progeny. So that just I am mentioning these points, and also the next coming to the important topic, that is the Garbhini Paricharia itself. So for that, the Viryavandam Sudam Sude, for getting a promote a clinic or the preconception clinic for as a fertility clinic for getting a healthy progeny. Here, Shuddhe Shuklartave Sattva Karma Klesha Chodidaha Garbha Sambandide Yukti Vashad Agni Riva Aranav. So here for this, all these factors should be very specific, and also for the preconception care, acharyas are mentioned different for their dietetics and whatever their ahara, vihara, everything are to be properly mentioned. And here consider that in the areas of special attention which is having Naram Visheshat Kshirajir Madhuraushada Samskrudehi Narim Tailena Mashesha Pittalehi Samupajaret. So that for the according to there, the food habits is also mentioned. And a nutshell of the preconceptual preparation is that all acharyas are mentioned. If possible, both the couple, male and female, if possible, undergo for a preconception care in the form of Shodhana therapy. Actually, if it is not possible, then go at least even some average now or otherwise like that. Or at least we know that most of the pregnancies are unexpected pregnancy, because after getting impregnated, then alone they will think, is it needed to continue or like that. Some may be in between this in their studies, or the family is not stable now, the financial thing is not stable. Such there are so many reasons are also coming for taking a decision. But actually, instead of that unexpected pregnancies, at least their mind should be mentally, they are psychologically they are prepared to get a or impregnated or otherwise to get a baby. If possible, it's better to do a Shodhana therapy like that. Even Snehana, Swedana, then Vamana, Payadikrama are to be advised. Instead of here, the male among the couple, male partner more than that of the male partner, female partner is to be better to be considered for this Shodhana therapy. In male also it is needed, but if the situations are to become, then at least the female are to, because the Kshetra Shuddhi is also coming as an extra point coming to the lady, and after that the impregnation and the pregnancy period is also the one important part is the lady itself. But even though for Bija Shuddhi, the semen, otherwise the semen parameter should be normal, and for that the male partner is also needed, but at least the female should be to do the preparations like that. In a menstrual cycle, if just after the period, if in modern we know that from 3 months of the conception itself they are advised to take the folic acid and like that. But here, if possible, Sneha, Sweda, Vamana. If not possible, then we can do for the Virejana like that. Then Vasti, it's not compulsory to do for the Vasti, Kashaya Vasti, etc. But even though at least for this Shodhana therapy is also good to get a preconception preparation and also preconception care. So just I would like to mention the importance of this preconception preparation as mentioned by our acharyas. So then coming to the Garbhini Paricharia, Garbhini means Garbha Asti Yasyaha, and Paricharia, care in all aspects. Here, here also, how to care the Garbhini. Very correctly, very correct specifically, it is mentioned that Purnamiva Taila Patra Asamkshobayet Antarpatni Bhavatyubacharya. That means here the how we are carrying a pot is filled with oil, then how we are carrying that pot. Like that, this Garbhini should be carried. Then coming to the objectives of the AMC, the first importance is to screen the high risk cases. If it is less than 17 years, when a Garbhini coming to our OP, for whatever their reason, for it maybe for the normal Garbhini Paricharya, or otherwise for their some of their ailments like any problem like heartburn, constipation, whatever will be the reasons. But even though if a patient, not if a Garbhini coming to our OP, we have to screen the case if it is less than 17 years or it is more than 35 years. Is there any history of repeated pregnancy loss, any history of preterm labor, stillbirth, neonatal death, then any congenital abnormalities, then she is having any diabetes mellitus, cardiac disease, any epileptic, if there is any medicines are taking for that. Such situations we have to screen first. Then we know the criteria. The normal pregnancy is the normal pregnancy with delivery of a healthy baby from a healthy mother, 38 to 42 weeks by date, and fetal weight of 2.5 kilogram or more, without any maternal complications. So for that reason, we have to screen all these things. And in obstetrics, when we are putting a scan, even after the infertility treatment or otherwise, if they one got conceived, then for the first the obstetrics investigations we have to do for the UPT, that is the urine pregnancy test. Then the indication of the UPTs, and also along with that, if needed, we have to direct for the HCG. Because the human chorionic gonadotropin hormone within 8 days in blood after fertilization. Actually, when it is increases, when we have to direct the patient for HCG exam investigation, just after 8 days of the after fertilization, it will be increased or raised in the blood. Then 12 to 14 days in urine. So from urine test, it will be just before the urine test itself, we can know the level from the blood. Then what's happening in the blood level? Doubling within 48 hours. Within 2 days, the value will be doubled. Then the peak value, it will be 18 to 12, 11 weeks of the pregnancy. It should be in peak level. So what is its clinical importance? Some patients will come with very low level of the HCG hormone. Then within 48 hours, if it is not increasing, there may be a chance of missed abortion or missed pregnancy loss is the one thing, one clinical importance. Then another is the ectopic pregnancy. So if it is not increasing and the level is to be found to be very little and not very much increasing, but it is in stable value, we have to suspect if there is any chance to get the ectopic pregnancy or the tubal pregnancy. So that is the clinical importance of the investigations during this time. Then in the first trimester scan, we are doing this to rule out or to assess if it is intrauterine or if it is ectopic pregnancy, and to know or assess the viability of the fetus. Then when we will get a yolk sac or when we will get embryo, for that the sac will be, the gestational sac will form 5 weeks and yolk sac will be 5.5 weeks. Then the development of the embryo will occur on 6th week and the fetal heart rate will get 6.5 weeks. So if there is any problem, the lady after UPT is positive, and then if we are advised them to take a scan, it's better to do just after 6.5 weeks. So from during that time itself, or within 7 weeks, 7 weeks is enough, because during that time itself we know the fetal viability, then cardiac activity, because the important sign is the cardiac activity. So if the cardiac activity is not getting, then the next time also we needed to follow up the scan. So it's better to assess within 7 and a half weeks is enough to advise to take a USG. Even though if it is forming on the 5 week, the gestational sac, yolk sac will be 5.5 week, embryo on 6 week, and the fetal heart rate on 6.5 week. So we have to know, or we have to to analyze the report. We just want to know. Then what may be the abnormal findings? while doing this first scan, to rule out or is there any ectopic role, then any missed abortion, then molar pregnancy, and also subchorionic hematoma. Actually, subchorionic hematoma is not much an abnormality. We can manage, or otherwise normally it will resolve. Then we will come on later discussion such cases. So these are the important investigations we are doing on the first time of the pregnancy, to assessment, and also the important investigation. Then in our case sheet, whatever the things we have to mention. If one lady is coming, if she is having one while case taking, is there is nausea or vomiting, if it is present. If it is present, it will be a mild, moderate, or hyperemesis. Then pallor, is it present or absent? Then edema, present or absent. If present, it may be psychological, means physiological, or otherwise pathological. When how we can identify it's physiological or pathological? After taking rest, it will be completely disappear. Then that is considered as the physiological. But after taking proper rest, but the edema is not disappearing, then it can be considered as the pathological. So what are the reasons for pathological edema? Preeclampsia, severe or chronic anemia, then cardiac failure, nephrotic syndrome. These are the reasons for the pathologic edema. Then urinary symptoms, if it is present or absent. If present, maybe increased urinary tendency or frequent urination, dysuria, oliguria, we have to evaluate it. Then thyroid gland enlargement, if it is present or absent. From the normal pregnancy itself, there may be mild enlargement for the thyroid gland. Then breast changes, if it is cracked, depressed, or normal. Then other physiological symptoms like constipation, heartburn, leg cramps, if it is present or absent, acidity and heartburn, then varicosities, if it is present or absent. Sometimes some patients may appear with the vaginal varicosity itself on the around the clitoris portion, and the labial varicosity may be there. Here the labia majora may be found with some sort of thick varicosities, and they may be like bulging in nature in some cases. Then hemorrhoids or varicosity in legs, etc., may be present. Then vaginal discharge, if it is present or absent. Then vaginal bleeding, is there any spotting? It may be present or absent. So when antenatal lady, if she coming to our OP, the case sheet should be in the inside of the case sheet. We have to evaluate all these factors side by side. Then what are the changes, normal changes happening in a pregnant lady? We know from first to 12 week of the pregnancy, that is the first trimester, there may be amenorrhea, morning sickness, increased frequency because it's a pelvic organ, and then there is a tendency to some pressure on the bladder, and the frequency of micturition may be increased. Some fatigue, the hormone, due to the hormonal changes, and like that, there may be chance of fatigue. The next is the 13 to 28 weeks, that is the second trimester. Here, the quickening will feel. Sometimes some patient will ask to us, that is the one third month last, they will ask, doctor, there is no feeling of quickening, or there is no feeling of movement is there. Such means anxiety will happening to the patient. So we have to correct, evaluate, and correct, understand them how, which time actually the what is the correct time to appear the quickening. In most of the primary cases, in primary and multi, it may varies from the 24th weeks itself. In the means in multiparous, it may be appear 1 week earlier, and in primary, it will be around 20th week. Then next, there is the third trimester, 29th to 40th week. Here, the fetal movements will be in very vigorous movements may be there. Then here also the frequency of micturition may increases. Then to last of the end of the pregnancy, there may be lightening, and all other features may happen. Then what are the components of ANC on antenatal care? There is the Ahara, Vihara, and Aushadha. These three are considered as the components of the Garbhini Paricharya or antenatal care. What is the role of Ahara Rasa or Ahara? Ahara Rasa from the maternal diet have three important roles. That is the nourishment of her own baby, nourishment of her own body, then nourishment of the fetus, and nourishment of the breast for the milk production. Then the properties of ahara should be palatable, lagu, that is easily digestible. It should be nutritious, brahmana, from first to last itself, Shira, Mamsarasa, Navanida, that is butter, then Ushnodaga, Surana is also indicated. Then consider according to Desha, Kala, Agni, and Matra, the properties of Ahara and the quantities of Ahara should be considered. As a whole, this shali, shashtiga, green gram, wheat, butter, ghee, milk, this group of food items are to be mentioned all of our acharyas. Even as a practical approach, ragi is also good food item, which will get the proper nourishment to the body and the iron, calcium supplement, etc. And this is also considered as a better food intake during the pregnant stage. Then coming to Aushadha. So Ahara, first is the Ahara. Ahara is very, very important. Then second is coming to the Aushadha. Aushadha in the form of Kshira Paga we are giving, in the form of Grudha we are giving. And if any other ailments, some other Kashayapana and etc. we can consider. While describing the medicines or aushadha to the Garbhini, Vyatinshchasya Mritu Sukhair Atichner Aushadhir Jayed. So whatever the medicines or food we are giving to Garbhini, it should be Mritu Sukhe Atichner. Without any Tichna, medicine should be given to the Garbhini. According to Kerala Chikilsa, the Kshira Paga of the following drugs are to be used. On the first month, according to the from first month to ninth month of the pregnancy, it is to be advised in, but it's not very commonly practiced by the patient. But even though, according to their condition, we can view this Kshirapaka. So on the first month, Bala, second month, Lakshmana, third month, Brihadi Dwaya, fourth month, Amshumadi, fifth month, Amrita, sixth, Nidiktika, seventh month, Yava, 8th month, Morva, and 9th month, Shadavari. So we can come in details of each drug. The name of the drug, first month, it is the Bala, Sida cordifolia. It having the properties of Rasa, Madura, Guru, Snigdha Guru, Virya, Madura, and means having Shita Virya. The therapeutic indications which is having in Mutra Kritra, then Rekta Pitta and Daurbalya. Lakshmana and Bala and Lakshmana we are giving to get the proper implantation or as a Garbhasthavana. Even after in infertility practice itself, after getting the ovulation, from the ovulation itself, we are started to give these medicines like the Garbhasthavana, which is having this Lakshmana or otherwise this Bala itself. Then here also Madura, Guru, Ruksha, Shida and also Vibhaga, Madura itself. Here the properties Garbhasthavana. And even Pumsavana action is also described for the Lakshmana. Then Brihadi Dwaya, here Brihadi and Kandakari, both are having the same properties. Kadu Tikta, Lagu, Ruksha and Tikshna. Here the Sangrahi, Pajaga, then Arujihara, Jorahara, etc. are the indications for the therapeutic indications of these drugs. So on the first month, Bala, second month, Lakshmana, third month, Brihadi Dwaya. The next fourth month, that is the Amshumadi. Here Desmodium jangeticum, Madhura Pitta, Guru Snigdha, Shida Virya and Madhura Vibhaga. Here also therapeutic indications in Kasa, Shwasa, Krimi, Chardi, Vadarekta, etc. the therapeutic indications. Then next is the Amrita. Amrita, here the Tinospora cordifolia itself, Tikta Kashaya, Guru Snigdha, Ushna and Madhura, Madhura Vibhaga. Here Jarahara, Vata Shonida, Amla Pitta, and it acts as a diuretic. There are so many different actions for the Amrit or Guduji or the Tinospora cordifolia or the therapeutic indications are also very good effect. Then next Nidiktiga or Kandagari, Salanam, Suratins. Here the Tikta Kadu, then Guruksha. Here Vida is Ushna and Kadu Vibhaga. It's having Pachana, Jora, then Krimi, Mutrala. Kaba Vata Shamaka are the main properties of Nidiktika. The next month, Yava. Yava is having Madhura Kashaya, Ruksha. It's having some Ruksha property and also Shida, Atistaulya, Balya, Lekhana, an antidiuretic, strengthening and Vachikarana properties for this Yava. Then next, that is the 8th month, Shatavari. Shatavari is having Madhura Titta, Guru Ruksha, Ushna and Kado. Here also Rekta Pittahara, Kushta, Prameha, Trishna, Chardi, etc. are the indications. Even Arshas is also therapeutic indication for the Morva. The next is the Shadavari. Shadavari is actually mentioned on the last month of the pregnancy because for the preparation of the breastfeeding itself, because it is having Stanya Vartaka, Rasayana, Gulmahara, etc. having the therapeutic indication. It's having Madhura Tikta Rasa, Guru and Snigdha, Shita Virya and Madhura Vipaka. So these are the drugs which are to be mentioned for the Masanumasa Kshirapaga. This Kshirapaga are to be prepared as generally we are preparing as the Kshirapaga itself. Then 1 glass of milk and 3 glass of water should be added to the drug, whatever it's Shadavari or Bala itself, it should be collected. And then it should be reduced to the Chira quantity. Then next, in practice, we are giving this Bala Chiraga Nagara as the drug for the, because in most of the first trimester or first just after getting impregnated, lady may have nausea, vomiting, lower abdominal pain, low back pain. These are the main things we are commonly we are seeing on the OP. So here the Bala Chiraga Nagara or in the form of Nayobaya Kashaya is found to be very effective. Then Phalasarpis. Phalasarpis also mentioned just after the ovulation is also very, we are starting. That also is a good medicine for the Garbhastapana. Then if needed, Kalyanaka Gruda. Kalyanaka Gruda, if there is any recurrent pregnancy loss or otherwise if there are any congenital abnormalities on the previous pregnancies like that, Kalyanaka Gruda is also a good option. Then Mahadanandara Gudiga, we are giving for the to reduce the acidity, heartburn, and then associated complaints that will reduces. Then Lakshmana Mula Kshirapaga. This Shadavari Adi Kruda if needed, if she is having Vata Pitta properties and then just after pregnancy itself they have say, some sort of white discharge and like that, the Shadavari Adi Kruda is a good choice. Then Kshirabala, suppose some hypothyroid problem, then any burning sensation, etc. Then we can give Kshirabala 101 mixed with some milk or like that. Then Laja Ardraga, Laja mixed with Ardraga, that will also is a good combination for to reduce the chardi or the vomiting and nausea. Then on second trimester, here also this Niobium Kashayam or otherwise, if there are any acidity, heartburn is still persisting, then Niobium Kashayam is a good choice, especially in homely prepared with increased quantity of Bala, less quantity of Jeera and less quantity of Jeera and Nagara. It's okay. Bala, Jeeraga, Nagara is the Nayopaya Kashaya. It should be prepared from the home itself with increased quantity of Bala and less quantity of other two. Then Drakshadi Kashaya if needed, because on the second trimester there may be hemodilution, as chance to get the hemodilution and like that. Then Drakshadi Kashaya is a good choice. If they have any urinary problems or edema, then Prahatyadi Kashaya or Prahatyadi Toyapaka is good. Then Stira Siddhampaya is also for the preparation of the Shirapaka. Then Guduji is mentioned. Then Kalyanagula if needed, because there is a chance to get mild constipation and like that. Then for external application, Lakshadi Gera or Nalpamradi Gera for external application. And Dadimadi Gruda, because on the just after the first trimester, if we are starting second trimester, there is a chance to get this hemodilation and like that, dilution and like that. So that this Dadimadi Gruda is also found good during the second trimester. Then coming to third trimester, here also we can continue this Dadimadi Gruda. Then end of the pregnancy, we can change this Dadimadi Gruda to Sukumara Gruda if there is any constipation or like that, or otherwise Sukha Prasavada Gruda is also, or Urvaru Gruda is a good choice. Then here also if needed Balajiragadi Kshirapaga we can add. Then on the last month, Shadavari Kshirapaka is a good choice to get as a next preparation for the lactation and the like that. So next, Here, these are the aushadas are mentioned for the general as a means Garpini Parichirya or as a part of the antenatal care. So first one is the ahara, then second one is the aushada, then third is the vihara. Vihara actually in cases of from the acharyas are itself mentioned, garbhopaghatagara bhavas should be avoided because adivyayama, adivyavaya, shoga, krodha, bhaya, and shoga. These are all factors which lead to this garbhopaghatagara bhavas. Even vegadharana. Vegadharana is also here mentioned, and abnormal postures in sitting or walking or whatever the things they are, it should be avoid the abnormal postures. Vegadharana, then manasika bhavas like krodha, shoga, bhaya, everything should be needed to avoid it here. Then these all things that may lead to abortion, otherwise IUD, intrauterine death, or it may end up with the IUGR, intrauterine growth retardation. So that whatever the viharas which are mentioned by the as in the Garbhopaghatagara bhavas, it all should be avoided. Just mentioning some about this Garbhapada and Garbhasrava. If it is the Garbhasrava which occurs on the fourth month of the pregnancy, that in the form of liquid form, and Garbhapada, it will be on fifth and sixth month of the pregnancy, that will be in the form of solid. So that's why Garbhapada and Garbhasrava. From the word meaning itself, the Srava is the liquid form and Pada is the solid form. Up to fourth month, it will be in the liquid form, and after 5 and 6, it will be in the solid form. The incidence of the pregnancy loss may be 10% induced, 75% on the 16th week, 80% on the 12th week of the first trimester, because that's the importance of the first trimester. If a Garbini planning to any journey or any other things, it should be the doctors should advise. We should advise them to wait for the 12 weeks, because during this time, during this 12 weeks is very very important, because this during this time the placental, the complete formation and the complete implantation of the placenta, formation of the placenta will occur. So whatever the changes or any garbhopaghatagara bhava or any heavy journey or any strenuous exercise, that may hamper the placental, complete placental formation, and the chances to get the pregnancy loss is very very high during the first trimester. So it should be kept in mind, and we have to advise the Garbini if they planning for any journey or any other more regarding their duties and like that. Then coming to the repeated, some points about the repeated pregnancy loss. Here, the genetic factors about 50%, anatomic 3 to 38%, infection being 5%, some endocrine and metabolic factors may be there. Then immunological factors about 5 to 10%. Here, the infections like the rubella, cytomegalovirus, then bacteria like malaria, toxoplasma, and parasitic, etc., malaria, etc., may be the different reasons for the pregnancy loss. We see that in COVID-19 and pregnancy, there is so many companies are affected with COVID-19. But fortunately, there are so many things are regarding as a protection to the Garbini regarding this COVID-19, because the placental or the vertical transmission was not predominant, and the neonatal will affected through the contact itself, not through the amniotic fluid. Milk, breast milk is not act as a carrier, but some elderly primary, overweight ladies, some Garbinis who having history of hypertension, diabetes mellitus, they have a risk factor for this COVID-19 also. Then some cases along this premature birth was reported, but not considering the other factors like the old age persons, such that comparing to these, Garbinis are not much affected. That was found during this COVID-19. Here also this coronavirus, we found that without having this vertical transmission itself, the abortion chance was found to be very less comparing to other type of like torch infections and other comparing to other infections. The rate of pregnancy loss was also very very less comparing to the other type of the infections comparing to this COVID-19. Some observations are found like mild respiratory changes, which is having upper or lower respiratory changes may be there. Some have coronavirus affected with the pregnant ladies, which having the increased tendency to urinary tract infections and burning sensation, fatigue, stress, headache. Then abortion is very, very less found. Then some cases having the premature preterm birth and a sign of hypertension may also be elevated. Then our approach in asymptomatic COVID cases like Shadangapana, Nayopaya, I explained previously, Guduchi, Guduchadi Kashaya, Drakshadi Kashaya, etc. in asymptomatic COVID cases, and Gobi Chandanadi Gulika, Danandare Gulika, Sidopalati Churna, Haridra Ganda, Villuati Lehya, etc. was very safe during these cases. And in symptomatic COVID cases, we administered this in small doses for a short duration. Villuadi Gulika, Sudarshana Gulika, Talis Patradi Churna, Agastya Rasayana, Haridra Ganda. On after that, as a rasayana, we are giving Vidaryadi Gruda also, because if in a dry cough, this Vidaryadi Gruda is found to be very effective to subside this dry cough happening due to this COVID-19, especially in pregnant ladies. Then some just point about this recurrent pregnancy rose due to the torch infection. For if one lady, if she is affecting with the 1 or 2 history of repeated pregnancy loss, then we should compulsory to evaluate if there is any torch infection is there. And if it is found to be positive, then Shodhana Chikitsa is mandatory to getting or before getting next pregnancy. On the first step, medicines like Garavisha treatment, like the Gundiadi Kashaya, Dushi Vishari Gulika, or Prabala Gukulu, etc., we can administer it. On the second step, Rukshana with using Tiktaka Gruda or Gukulu Tiktaka Gruda, then Virejana, Kshiravasti, then Yoni Kshalana and Uttaravasti. On third step, after getting pregnant, if one lady is coming to us, if she is having any recurrent pregnancy loss due to torch infection and she is pregnant now, then we have to continue that pregnancy by administering like Garbhasthabana medicine like Pala, Lakshmana, Kshirapaga, Palasarpi, etc. We have to give it. If she is pregnant and again she got aborted, then for getting to next pregnancy, we have to prepare by Shodhana therapy and by giving the Garavisha treatment to the lady. Here some cases which is having here also these patients having the recurrent pregnancy loss due to some of the torch infections. Here it is found age of the lady 24 years and abortion 3 times. The rubella and cytomegalo virus have to be found increased. On her examination, per speculum examination, there is yellowish discharge was there. The treatment taken for her 6 months of the treatment and resulted with a healthy baby weighing 2.85 kg. Here, these are the 6 cases. I'm not going in details about these cases, but here all these 6 cases, this Shodhana therapy are to be conducted before getting their next pregnancy, and without any further abortion, they got a healthy baby after the Shodhana therapy. Then next is the genetic factors or the screening for the genetic factors for the chromosomal anomaly. Actually, 85% in Down syndrome, here the trisomy 21 may be elevated. Then in the normal anomaly scan, we can found that nuchal translucency. If the nuchal translucency or NT, if it is more than 3.5, then there is a increased chance to get the genetic or congenital abnormalities. Some cases it may be anencephaly or hydrops fetalis may be affected. So that this is a case report or case of one patient who is having 23 years coming to OP with her Garbhasrava, means as a diagnosis as the Garbhasrava. She's on her first pregnancy with history of abortion on 3rd month. Her NT value or nuchal translucency, it was found at 5.5. Here on her anomaly scan, there was the hydrops fetalis and the intrauterine demis of the patient. So after the pregnancy, means after her abortion, some medicines are to be given internally. And after checking her TORCH panel, it was found that a weakly positive was cytomegalovirus and herpes simplex virus and rubella found to be positive. So here the Shodhana therapy, after getting the after the complete Shodhana therapy, again she got impregnated, and on her anomaly scan, without there is any no problem, the single alive intrauterine gestation of 7 weeks and 3 days, without any complication, she delivered a healthy baby. But here I think maybe this Shodhana therapy may work in most of the cases. Not we can say that in all of the 100% of the cases, but even though in most of the cases we can get a good result. Then if there is a genetic factor is to be increased, then some invasive tests like amniocentesis, chordosynthesis, and chorionic villus sampling, if needed, we have to, these are the next step investigation or the screening test we are doing. On the anomaly scan, on 16 to 18 week anomaly scan, here the head and neck, we can see this means very clearly. If there is any hydrocephalus, there is an indication here. Then spine, to rule out for the spina bifida, then to know the structure of the thorax, abdomen, face, limbs, and amniotic fluid. All these things, all the means informations we can get from the anomaly scan. Some fetal biometry like biparietal diameter BPD, then head circumference, FL, that is the femoral length, AC, abdominal circumference, placental position, and amniotic fluid. These we will get from the anomaly scan, if it is according to or corresponding to the gestational age, or if it is not, or if there are any anomaly present, etc. We will get from the 5th month anomaly scan. Then fundal height chart from the at the 12th week, 16th week, 20th week, 26th, 32, 40, and then again on the 36th week it will be means at the top of the uterus, and on 40th week it will be coming down towards the next means as which is present in the 34th week. So on the 12th week it's as a pelvic organ. From the 16th and 20th week, it is coming to as an abdominal organ. Then on 26th or in between 24, I think 24 week, it will be on the umbilicus. Then it will be grow up to the sternum and like that. So this is the means approximate the fundal height measurement of the fetus. Then some anatomic reason for the recurrent pregnancy loss. Here the cervical incompetence is a most common. Because if one lady, if she is having a previous history of cervical incompetence, or otherwise, if she is having any cervical encirclage operation which was conducted, or otherwise any cervical incompetence, that should be cared. Then congenital malformations may be there. Then uterine fibroids and adhesions, then also there to get a uterine factors for the repeated pregnancy loss. The next congenital malformations, here we can see that the double cervix, like the uterine segmental anomaly, here also there is a tendency to get recurrent pregnancy loss. If that patient is got conceived with two I think 2 uterus and 2 cervix may be there, then segmental anomaly, then we can find there is not much difficulty to get impregnated, but there is an increased chance of pregnancy loss, because by growing the fetus, there is not much space to occupy and also to grow. So that's why there is an increased tendency to pregnancy loss. Here, the cervical incompetence on the second trimester, there will be chance to the pregnancy loss is due to the important reason is the cervical incompetence. Here, a case, she is having married since 3 years, conceived with medicine, but on 4th month, the abortion occurred. As in the form of mini labor, the os will be in the form of dilated, and here there is no actually from the anomaly, not anomaly scan, from the third month scan itself, there may be the cervical os may be dilated, or otherwise the short cervix, etc. may be the appearance, but actually it is not mandatory to express. There may be a sudden flow of the liquid outside, and also the baby will come out in most of the cases of the cervical incompetence. So if such a history, then surely they should conduct the encirclage operation or otherwise by using the Garbhasthabana medicine, they have to take complete rest because the os may be a chance. In previous os, we can see that there is the dilatation of the os is very, very specific feature of the in cervical incompetence. So here so much care is taken during the second trimester. Here, in this Garbhasrava and Garbhapada, some medicines have to be advised by our Acharya. That is, if the patient is having a history of pregnancy loss on the first month, then Madhugam Chirapaka by using Madhugam Shaga Pijamcha Paisya Suradaruja. I'm not going in details of every drug because up to 9 months there are different medicines that to be described. Just I will brush up that drugs. Here the Madhugam Shaga Bijamcha Payasya Suradaru. These are the name of the drug which are mentioned if the patient having a history of pregnancy loss on the first month, or on the first month there is a chance to get pregnancy loss. Then if she is having on the second month any spotting or any previous history on the second month, here Ashmandagaha, Krishnatila, Tamravalli, Shadavari. Here Ashmandagaha, then Tila, Tamravalli or Manjishta, and Shadavari are to be mentioned as the Kshirapaka if chance to get a pregnancy loss on second month. Then third month, Vrikshadini, Payasya, Lada, Cha Ulpala Shariba. Vrikshadini, Payasya, Lada, Cha Ulpala Shariba. Here Vrikshadini, then Payasya means Vidari Gandha, Lada means Jodishmadi, Ulpala, Ambal or Nifara Alba, and Shariba is the Hemitismus indicus. So these are the drugs are mentioned for the if she is having any chance of pregnancy loss on the third month. Then on fourth month, Ananda Shariba Rasna Patmaga Madhuyashtika. Ananda, then Shariba Hemitismus indicus, Rasna, Alpinia calcarata, then Patmaga and Madhuyashtika, Lycerisa glabra. These are the drugs which are to be mentioned to prepare the Kshira Kashaya if she is having any pregnancy loss or on the previous pregnancy, or otherwise any spotting or problems on the fourth month of the pregnancy. Then on fifth month, Kashmeria and Brihadidoya. Here Kashmeria, which is having Melania arborea, having Pitta Kashaya Rasa, then Brihadidoya, which we mentioned on the Kshirapaka, means Masana Spantuli Kshirapaka. Here, these are mentioned on the fifth month of the pregnancy if there is any chance to get pregnancy loss. Then on sixth month, Prishni Parni, Bala, Shigru, Shodamshtra, Madhuparnika. Prishni Parni, Uraria pitta, Bala, Sida cordifolia, Shigru, Moringa olifera, Shodamshtra, Gokshra or Tribulus terrestris, Madhuparnika, Guduji or Tinospora cordifolia. So here these are mentioned as the sixth month if she is having any tendency to get pregnancy loss. Then on seventh month, actually this quotation from the Ashtanga Hridaya Sharirasthana on the Garbhasrava is the Garbhasrava Prakarana. Here coming the shloka that is starting from the here itself. Then Shringadaga, Bisa, Draksha, Kasheru and Siddha. Shringadaga, then Bisa, Draksha, Kasheru. Kasheru is the and next is the Siddha. These are the ingredients of the Kshira Kashaya which is mentioned on the seventh month. Actually, if all these drugs are not available, but the available drugs we can select for the Kshira Kashaya. Not compulsory to get all these drugs. Then on eighth month, Kabitwa, Vilya, Brihadi, Padola, Ikshu and Nidiktiga. Kabita, Vilya is the eagle marmalose, Brihadi, Solanum indicum, Padola, Ikshu and Nidiktiga or Kandakari. These are the drugs which are mentioned on the 8th month if she is having any chance to loss of the pregnancy or like that. Then 9th month, Shariba Ananda Payasya Madhu Ishtika. Shariba Hemitiscus indicus, Ananda Payasya, that is Vidari Kanda Madhu Ishti. So these are the drugs on the 9th month of the pregnancy. Then on 10th month, Madhueshti, Nagara, and Amaradaru or Devadaru. Here, Madhueshti, Glycerisa glabra, Nagara, Zingiber officinale, and then Amaradaru or Devadaru Cedrus deodara on the 10th month. Actually, from first month to 10th month of the pregnancy, if there is any complications happen, then Acharyas are advised to take the Ksheerapaga of these drugs. Actually, then practically we are not much using these combinations, but here Acharyas are beautifully mentioned from the first month towards the 10th month of the pregnancy itself. But in our common practice, we are using on first month, second month, third month, and up to the first trimester, because if there is any tendency to get the pregnancy loss, it's coming on the major on the first trimester. So that's why we are continuing these medicines up to first, second, third, at least fourth of the pregnancy. But from that, we are not much continuing. But as in the Kshirap Kashaya, it's very good to practice. So then next is the all the some abnormal findings I found on the first during the first scan. There may be chance of the ectopic missed abortion for this molar pregnancy and the subchorionic hematoma. So here one case which showing the subchorionic hemorrhage. Here the she is having a history of abortion, but having the torch infection as there. After treatment, she got conceived. And here 1.3 centimeter subchorionic hemorrhage was noticed on the first scan. Mahadanandara on her prescription, I advised her to take Mahadanandara Gudika, Phalasarpi in small amount, Bala Lakshmana as Ksheerapaga to continue. Here, this was her first scan report. Here the single live intrauterine gestation and the subchorionic hemorrhage measuring 13.6 millimeter was there. Actually, this subchorionic hemorrhage is not much problem during the pregnancy. Some may be worried about that. In some cases, there may be spotting of this some red colored spotting on the vagina per vagina may be happen. But in most of the cases, that may disappear normally within the on the next scanning itself. That will means naturally they may get cured, or otherwise with medicine itself. I think medicine is having not much role, but here I have given that such and such medicines, but after the time if we are scanning, there is no much subchorionic bleeding hemorrhage. Here the subchorionic hemorrhage is not in the placental side, but is the extra placental sides. That's why we are not worried about that subchorionic hemorrhage. In most of the cases, there is not a tendency to get pregnancy loss or like that. But the patient may worried with the spotting and this presence of this hemorrhage and like that. Then another case, secondary infertility. She is having LUF, that is luteinized unruptured follicle. Here the internal medicines like before getting pregnancy, this Chirivilladi Kashaya, Hinguvajadi Churna was given internally, and Lakshmana Arishta was given. Because here the Lakshmana Arishta, the role of Lakshmana Arishta to get the rupture of the follicle and like that. So as the diagnosis was itself was the luteinized unruptured follicle. Here after the treatment, after 1 or 2 months of the internal medicines itself, she got pregnant or she got conceived. Here the single live intrauterine gestation with 12 weeks and 12 to 14 weeks. Here also 2 into 1.2 centimeter luteal cyst was there, and 3.7 into 2.5 centimeter corpus luteal cyst was present. But actually, here she is having nausea and vomiting, so this Phalasarpi was not given, she taken internally. But actually, without much medication, without much intervention, that corpus luteal cyst also got disappeared. So here, there is no need to much medications for this simple corpus luteal cyst during pregnancy or subchorionic hemorrhage during pregnancy. But here we have to take care if it is increasing or if it is what is happening to that cases. That was the case report. Here the that scan report of that patient. Thick walled cyst on the left adnexe, closely shutting the left ovary. Possibly there is a exotic corpus luteal cyst. She is having 12 to 13 weeks of the pregnancy. But here also, without any proper intervention, that got disappeared. Then some common ailments during the pregnancy. These are the charti or vomiting. Then in hyperemesis gravidarum, malabandha or constipation, arshas, Pindigo Deshtanam, like muscle cramps, Kadishula, low backache, and pregnancy-induced hypertension. So nausea and vomiting, we know the nausea itself is a Vekta Garbha Lakshana. Because due to the presence of increased HCG hormone, this nausea is a getting tendency. And in some cases, we will tell that if there is nausea and vomiting is a good sign because there is enough HCG to support the pregnancy and there is less tendency to get abortion and miscarriage like that. So here 70 percentage on the 12 to 14 weeks. And 50 percentage have nausea and vomiting, but 25 percentage have it normal, and only the 25 percentage is unaffected regarding this nausea. Then some internal medications like Dhanandara Gudika, Vilwadi Lehya will help sometimes. Then Bala Kashaya, Nayobaya Kashaya, but even some patient will tell that is unable to take this Chira Kashaya itself because while taking the Chira Kashaya itself, the nausea and vomiting will increases. In such conditions, we can give small doses of Thalisapatradi Churna, even if it is mixed with some honey and lemon juice, mixed with lemon juice and this. Honey, Thalisapatradi Churna is having a role in Aruji, Agnimandya, and vomiting, nausea, etc. Then Ashta Churna, if she is having any acidity, heartburn, then small doses of Ashta Churna can be mixed with Takra or like that, or in hot water. Then Dadimashtaga Churna is also good to control in simple vomiting. Then Laja and Ardraga is a Laja Ardraga. Laja alone or Ardraga alone, even mixed with Laja Ardraga is also good to control the vomiting. Then ginger paste mixed with honey is also good. Then Dadima Sorasa is a good measure to reduce the vomiting in drop by drop they have to take, and by spoon using not as a juice or drinks, but instead of that using a spoon like that, it's a good measure. If the kabaja, if it is associated with vadiga, then pomegranate juice we can mix with sugar and honey. If it is pitta predominant, then larger churna mixed with sugar is a good choice. Then if it is kabaja, larger peya is also good choice to reduce the vomiting and nausea. Here also some measures like Vilwadi Lehya mixed with Shanka Basma is found to be effective. And then some patent drugs like Madhi Balarasayana, or even Live 52 DS syrup is found to be good because to control the increased nausea and vomiting. Then whatever the medicine help to reduce the acidity, that will also helpful. Then Guduchadi Kashaya, sometimes it may be helpful. But if she is having hyperemesis gravidarum, most of these medicines will not work because instead of taking a single spoon of water, that is start to be vomiting. Here this a dry mouth, excessive weight loss, less urination, low bowel pressure, blood pressure, then faster heartbeat, extreme thirst. These are the symptoms of the hyperemesis gravidarum, and here there is less tendency to respond with our medicines. But in simple nausea and vomiting, we can manage with our medicine, their diet regulations, and also food restrictions that will be helpful. Then acidity and heartburn. Here is more common in first and the last trimester because the retention of the gastric juice and regurgitation is the reason for that. Here some measures like to avoid the pickles, to sour, then hot chilies in diet should be avoided. Do not lie down just after food and meal, etc. should be considered here. Then Shadavariyadi Kshirabhaga, Guduchadi Kshirabhaga, Dhanandara tablet, Vilwadi Lehya, then Avipatti Churna and Shanga Basma is also a good measure to reduce the acidity and heartburn in the pregnant ladies. Here one case, here she is having second gravida, 26 years lady. So 26 years lady, she on the pregnancy time itself severe acidity, heartburn. She is unable to take any type of food like that. The prescription given was the Mahadhanandara Gudika 2 times before food, and the Avipatti Churna mixed with the Shanka Basma just morning and evening just after the food. Actually, by taking these internal medicines for 2-3 days itself, she reduced her acidity, heartburn, and from the first month she continued up to the delivery, but she's very comfortable, and because she tell that if it is means stop the medicine, then again she's not comfortable, and again she continued without any complication. She delivered and like that. So here that will be very means comfortably managed with these medicines. The next is the constipation. Constipation is the common ailment during pregnancy. Actually, during the constipation itself, due to the effect of the progesterone on the gut, that will cause constipation. Because normally, if the lady is having, is there any predisposing factors, or if she's having any history of constipation, actually it is not needed, it's not mandatory to get the constipation during pregnancy, because the effect of the progesterone itself cause the constipation. And another factor is the pressure of the gravid uterus on the rectum, means the alimentary canal and rectum. That may also one reason to get the constipation. Here, it's about 11 to 38 percentage is prevalence is there. Means to control the constipation, increase the fluid and fiber intake, because most of them are taking some, if any junk food or otherwise they having without any fiber content, that may cause to increased constipation. Then if she's having any arches or these hemorrhoids, then onion prepared with the or onion Ksheerapaga is a good measure. I used it to practice. The small onion, that is the not leshuna but palando. Palando is to be used for the Ksheerapaga. Just one handful of Ksheerapaga, I mean onion should be taken, and the 1 glass of milk that should be added with the 1.5 glass of water. It should be cooked well, and that milk to be given internally during the night. That will relieve the pain if there is any pain due to arches and like that, or fissures like that. And that will relieve the constipation, and if any burning or means wound or any burning, that will also get reduced. Then Nayobaya Kashaya, Dhanantara Gudika is a good choice. Then Tribala Churna is Draksha Kashaya. Draksha means this dry grapes. Grapes are to be means prepared Kashaya, and into that Tribala Churna is to be added. That is also a good measure to reduce the to relieve the constipation. Then Udavarta, if it is Udavarta, then Matravasti with Baladailam is a good choice. But after 8 months of the pregnancy, then alone we have to employ these Vasti procedures. Then Abhingam with Dhanantara Dailam or Pinda Dailam, etc. is also good. Here, Mridviga Kwadam and Pravut Churnam. In the Mridviga Kwada, we can add a small quantity of Pravut Churna. I think it's better to do the Tribala itself enough to manage this constipation and Udavarta. Then here, if needed on the last trimester, small doses of Aranda Thaila mixed with milk. If having good means chronic constipation, then we can add in less quantity. Then leg cramps. Leg cramps is also here add so many milk in the diet. From Acharya Satapi mentioned from the first during the first month of the pregnancy to the butter and then ghee, milk or kshira, everything as the bhatya for Garbhini. If she is starting, if she can start from the first trimester or first month itself, there may be no less chance to get leg cramps. But on the first trimester, she is having a nausea, vomiting, and then intake of the food is not much proper. Then the reduced absorption, reduced calcium absorption, there will be more chance to get leg cramps. Avoid exposure to cold. The calcium preparation should be take. Then avoid the standing long time. Then walking for long distances. Then the application of the Abhingam of Sahasradi Taila, mild hot fermentation, it may be just to relieve the means this cramps on the calf muscles and like that. But the in general administration of the ragi like food. Then milk, Ksheerapaga, or as a food, the milk in the form of food, etc., will help to reduce the leg cramps. But not whatever that intake is there, but we have to ensure there should be the proper Agni Deepti, because in Garbhini we are doing so many Brahmana therapies like Ksheerapaga, whatever we are giving the Vidaryati Ksheerapaga, or then other types of Shadavari Ksheerapaga, etc. But if we are giving Ksheerapaga, they should have the proper Agni Deepti should be there. Suppose in anemia also we found that we are done some type of projects on the rural tribal colonies. We found that there is nutritional deficiency and anemia may be there. But actually we managed by using simply Ashtachurna serum. Because what's happening there, Here the proper absorption or proper Agni is not there. So if there is only getting the proper Agni and proper digestion, then alone, if for Garbhini also, this proper absorption of the calcium or iron will occur. Instead of that, we are giving this Brahmana therapies that will not cause any means remarkable effect. Then another one is the LBA, that is the low back pain. Here also it's very common and due to the postural changes or otherwise due to the low doses and that etc. may be the reason. Here also some local applications or internal medicines will help to relieve. Then some the treatment of the urinary tract infection. Urinary tract infection is where UTI is very common during the pregnancy. I had to add plenty of water, barley water, Punarnava Kashaya, Brihatyadi Koda, Chandraprabha Vadi for small doses for a short duration, Gokshura, etc. will help to reduce the urinary tract infection. PID and one case she's having recurrent urinary tract infections and means pelvic inflammatory disease. Here, before getting pregnancy itself, she's having again and again this recurrent UTI and repeated pregnancy loss happen. She's having severe burning sensation. Then before getting the next pregnancy, Gudujyati Kashaya, Chandraprabha Vadi was given internally. Then Chandanasava was given. Using Avibhakti Churna, Virejana was done. After the Virejana, Vastyamendaga Gruda was given internally. This is not during the pregnancy, but just before getting her next pregnancy. Then after conception, Gudujyati Panaka and Eshti Madhu Chirapaka was continued on the first trimester. Here, on the next, after the treatment, on the next pregnancy, without much complication or without any pregnancy loss, that got a that was a healthy conception. Then candidiasis. Candidiasis is the very common during pregnancy because it is due to the increased hormonal level, increased vaginal discharge. The pH of the vagina is to be changed. Symptoms are the copious discharge with itching. Treatment like Dhara, Araghadadi Kashaya, Tabala Kashaya, we can use as an external Chalana here. Here also Chandraprabha Vadi for small doses for a short duration. Advised to take her proper hygiene and like that. The next coming to the prameha or gestational diabetes, it is very common during nowadays. This candidiasis and the recurrent urinary tract infection is very common in the if she is having gestational diabetes. Here the Vatika prameha, which is having 14 types, and Paitika 6, and Kabaja is having 10 types. The Nidana of the prameha, which is having Aharaja, Viharaja, Manasika, Rogaja, and Anyaja. Here Ahara, especially Kaba Ahara, Viruddha Ahara, Kabaja Ahara, like Guru, Snigdha, Shida, Madhura, Nava Annapana, because we know nowadays all the Garbhinis, all of us, we are using Nava Annapana. So many of Madhura Rasa, Ikshu, Dadi, Guda, these are all Kabahara Ahara, may chance to get increase the chance of diabetes, gestational diabetes. Then Viruddha Ahara is also a chance to get here. Then Viharaja like Divasapna, Alasya, Manasika Nidana like Chinda, Shoga, Baya. Then Rogaja and Anyaja, which including Ajirna, Agnimandya, Bija Dushti, etc. are the reasons for the prameha. Due to this, Nidana Seva, Kabadosha Vriddhi is happening. Ama in the Jadaragni, and here the Rasa Rekta Mamsa Medo, Dhatu Agnimandya is happening there. And increased Kleda formation, increased urination, and there may be chance to get gestational diabetes mellitus. So the management will be in the form of medicine, diet, and yoga therapy. Some formulations which help Visha Katagadi Kashaya, Misha Amaligi as the single drugs, then Amrita Mehari Jurna, Gudujyadi Kashaya, Pipalik Shirapaka. If there is proper Agnimandya, if there is Agnimandya, if there is not proper means Shrodha Shuddhi, or if there is Shrodha Rodha, then Pipalik Shirapaka for a short duration is also good to reduce the chances of the gestational diabetes mellitus, especially if they have any family history. In such patients or obese patients, overweight means obese, then family history, they have a more tendency to increase the gestational diabetes mellitus. So they should be correctly screened. Nowadays, this all are Sukumara Prakriti without having not much exercise and like that. Their food habits mainly like this polished rice instead of there is no fiber content in the food habits. So these are all contributing factors for the diabetes mellitus. The Gadra Kashaya, then Mahatiktaka Kashaya, Sanadigana, all these Kashayas during the pregnancy we are giving in the prepared form, I mean, homely prepared, not in the bottle Kashaya, because it is better to avoid these preservatives by adding the to the medicine, especially on pregnancy. Then Punarnava Mandura, Datri Loha, Ashwagandha are also say good choices here. The drinking water like Guduchiadi Panaga, Nishakadagadi Toya Paga, Takrapana, Laja Manda. Then milk, if milk is used, skimmed milk is better. Bala, Guduji, Ashwagandha, because after getting diabetes also there may be tiredness and like that. So here if it is needed like Vataja condition, Chirapaga we can add. Here is a patient. She is having gestational diabetes mellitus. On the fasting sugar, it was found that 115 milligram. And then here she also having the epithelial cells and bacteria. I found that I described on the previous slides. There is an increased tendency to get the candidiasis and increased urinary tract infection is very, very common during the gestational diabetes mellitus. So such a patient here, she found the epithelial cells is to be the epithelial cells and pus cells was increased, pus 10 to 15 per HPF. Epithelial cells is about 30 to 35 per HPF. Bacteria is present here. Then HB was 10.8 like that. And but in the scan report, there is not much problem here. She treated with here giving some internal medicines like the Mahadhanandaran Badi was given internally. Then Tadimadi Duda was started to take, and Kudujadi Kashaya Churna was given as the Kashaya Paga. But it's found to be this urinary tract infection is also found decreased for the after getting taken these medicines. Here also we can add Gopshura Punarnavadi Guliga. Here this Gopshura and Punarnava is not much complication to the pregnancy, or even sometimes Chandraprabha Vadi can given for a short duration with smaller doses. Then prevention is better than cure like that, especially any have the family history of diabetes. This preconception care is very, very important. Then antenatal care, dietetics and yoga therapy is also good. So here one case of the infertility patient, she is having diabetic and PCOS, obese patient married since 8 years, and she's taking insulin on the for her diabetes mellitus. This amenorrhea was 8 months. On the treatment time, it was given some medicines like Chiriviladi Kashaya, Vaishwandra Churna to get the Tattopni Mandya correct. After the Shodhana therapy, now I am going to details of that treatment history. But after this Lekhana Basti, Uttarabasti and other Shodhana therapies, she got conceived. But actually, during the time of conception, after this Shodhana therapy, it was found that like Takradara and Udvartana, Snehapana, etc. was given to that patient. But after that time, her sugar was coming to, this diabetes was coming to normal. But again, on the first trimester, but end of the first trimester, she again started her problems with diabetes in the form of gestational diabetes. Here, Gudujadi Kashaya Churna, as in the form of Panaka, Chandraprabha Vadi was given for the 1 month. Then Nisha Amalaga was continued. Falasarpi was given. But even though after some time, I think on the 6th month onwards, she was going to under insulin, because on the before coming to the treatment itself, she was taking on her 26 years, she was taking this insulin. But after the Shodhana therapy for a duration, it was avoided. But again, on the 6th month of the pregnancy, it was started. But even though it was managed with the parallel to that, our medicines are also supplemented. Then pregnancy-induced hypertension. As a complication or associated problems of this diabetes mellitus, we found that pregnancy-induced hypertension and other features like here this some to rule out is there any chance to get eclampsia or pre-eclampsia are to be noted here. In cases of pre-eclampsia, we know that the increased hypertension more than 140/90, then proteinuria, and also edema. Edema here not only in the pedal edema, but in some patients they have edema on the vaginal region or the face itself after taking any rest or medicine that will not subsided. So there is a tendency to getting eclampsia or pre-eclampsia. We have to evaluate correctly because after getting this edema is not cured by the resting or proper resting, and also the BP is increasing more than that of 140/90. Then the proteinuria is present on the urine. Surely we have to confirm it is the chance to get eclampsia or it is the condition of the pre-eclampsia. Here the Punarnavadi, Brahatyadi Kwada, Gokshura, Badriga, etc. will help to control, not because here the not alone we are not mandatory to go for the Ayurvedic management itself, because if it is needed we have to as a parallel we can give some medicine because the conventional therapy may go on. Especially if the BP is increasing, surely needed to take the modern medicine also here. Then Varshabu Moolam Nishkadam Yojayet Bhadra Dharuna Tat Pibed Madhu Samyuktam Shunastri Murvaya Saha. These are some combinations that to be explained by Acharyas. So that here also Gokshida Punarnavadi or Punarnavadi Kashaya, etc. will help to control this edema and all other problems. Then another condition is the oligohydramnios or polyhydramnios. Here the amniotic fluid index, if it is less than 6, then it is considered as a very, because there is no proper fluid or amniotic fluid to get the movement of the fetus and like that. In such conditions, Pushmanda Valeha, Vidaryadi Kshiravaka, etc. is good. Surely we have to means confirm there is Agni, or if Agni is not proper, then on first few days we have to give Shadangapana or in Ashtachurna in small doses to get the proper Agni. Then after we have to give this Kushmanda Avaleha or Vidaryadi Kshirapaka as in the form of Rasayana. If Agni is not there, it will not work. Then if the amniotic fluid index is more than 12 in 4 pockets, because we know how to measure the amniotic fluid and the index like that, then Punarnavadi or Gokshida Punarnavadi Kashaya, etc. will help for the management for the as a parallel to the polyhydramnios. Here one patient, she is having 34 years, second pregnancy, LCB is having 10 years, she's having a child having 10 years. On her scan report, it was found that this liquor is just adequate. Actually, it is not much, as in not considered as the oligohydramnios, but even though just adequate was there, so without getting more reduced, I started this Kushmanda Avaleha and also some Gudujyadi Kashaya. She is having some other conditions like burning sensation and also insomnia was there. So Ashwagandha Churna mixed with milk was also given, advised to that patient. But after the next time, it was all other features are to be get controlled and like that. Then next is the weight gain in pregnancy. We know the total weight gain in the pregnancy is the 11 kilogram. On the first trimester, it will be 1 kilogram. On second